And I hear you've been stepping up your training in preparation for it.
How do you know that?
You told me.
You've been spying on me.
Welcome to A Window on SAHMRI, where we take you inside South Australia's independent not-for-profit health and medical research institute. Each episode, we get to know the people driving our life-changing research, getting into what motivates them personally and how their work is delivering a brighter, healthier future for all.
Karen, what is it about bringing new life into the world that you think is so special, being part of that experience?
It's been a little while since I was in the labour ward delivering babies, but it's funny because you think you would get used to it and, you know, it's part of your job and it's just something that you do every day, but every single time it was different, it was special, it was amazing. I guess just being part of that whole experience, I really enjoyed being part of the family's experience during that time. You know, of course, you're helping to bring this new life, but just, you know, the joy and all the emotions of the family at the same time, you sort of get caught up in all that emotion. I was getting goosebumps remembering it. So yeah, it was beautiful. I was very privileged to be part of that and be part of those families' journey. Yeah.
What do you remember about delivering your first baby?
I was terrified. You don't do it alone. And we used to have to see a lot of deliveries before you actually got to do that by yourself. But I was very scared. But, you know, it is a natural process and babies are going to come out regardless whether you're there sort of helping or not. But yeah, it was just an amazing experience. Yeah, it was very special.
What is scary about holding life in your hands that's so precious at that first stage?
I guess it was less scary about holding the life in your hands, but I guess you have the safety of the woman. You have to look after two people. You know, if you're a nurse and you're looking after a patient, you have one person to worry about. They're there and you can see what they're doing. And
I guess you feel the weight of how important it is as well. Like it's the most important thing there is, isn't it?
And, you know, there's ways you can monitor the health of the baby throughout delivery, but you can't actually get to them. You can't see them. So it's just such a big responsibility.
There's a bit of like a leap of faith almost in each delivery.
There is. You know, and there's the health of the mum and the baby, but there's also, you know, it's a major event for the woman and her family and, you know, you want to make sure that it goes how she would want it to go. And yeah, there's just lots to consider. I found it a big weight, but, you know, loved it. But yeah, it's a big responsibility.
How would it feel once it was successful though and you sort of had the aftermath, afterglow of it?
Yeah, and the afterbirth, yeah. Oh, fantastic. Relief, joy, you know, like I said, being part of that. The emotion of the family, seeing the baby and checking and everything's all fine. And then, you know, just seeing that family unit together and yeah, it was great. I loved that part of it.
What drew you to wanting to care for mothers and babies in the first place?
I'd always been sort of drawn to caring for people and wanted to be a nurse. And so I started nursing, general nursing, but I was just always fascinated by pregnant women and always loved children. You know, at school I didn't know whether I wanted to be a kindy teacher in childcare or a nurse and went down the nursing path. But yeah, was fascinated by pregnancy and just loved the whole thought of, you know, helping care for women and bring new life into the world. And so then when I went and did my midwifery and had a taste of that, there was no going back to general nursing. It's like this is, you know, where the area that I want to be in.
So that really hit home when you were part of those kinds of experiences, which was so intense and momentous. You felt like this is my life purpose.
Yeah, exactly. And even, you know, there's a lot more areas to work in midwifery than just the labour ward and that those last day or so. Even just caring for women throughout pregnancy in the antenatal period. And, you know, just knowing that, you know, there are things that you can do within that time frame that can actually impact the life of the growing baby into childhood and sometimes into adulthood.
And it all counts. I was going to ask you about that. What is the importance of that start of life health and getting that period right in terms of the flow-on effect?
Well, you know, there's more and more research all the time to show how important that is. And now it's extending even further. And then, there's a lot more research into pre-pregnancy health and, getting things right before you conceive. So everything's set up for, an optimal environment for the baby. But, a lot of women are really motivated during pregnancy too to make changes because they're invested in, they want to do the best for their baby. So it's a really good time to educate women on, what's best for them and their baby. And there are some small differences that they can make that can help.
But those small
things.
Differences can make a significant difference potentially to
Yeah.
the child.
Yeah.
You spent many years caring for premature babies on the neonatal ward at the Women's and Children's Hospital.
Right.
What did you see families really struggle with during that time?
Look, a lot of babies, do really well that are born early. We've come a long way, the care of these babies, and babies survive now that are born at much earlier gestation than they used to, which is fantastic. But you just see the mums and the dads just struggle with the fact that sometimes these babies are in hospital for so long. They tend to have a bit of a roller coaster ride. They might be doing really well and then all of a sudden they're not doing so well, and just seeing the families go through that and
that uncertainty.
Yeah, the uncertainty, not knowing how things might pan out. How will their baby ever, will they take them home? Will they be a healthy, normal child that develops normally? And a lot of times they just get exhausted because they want to be there all the time, with their child. And then seeing what the babies go through, with some of the procedures and that they need to have done.
And it must be challenging for some families to not feel a bit bitter about it as well, because it's sort of like, well, why is this happening to my newborn?
Oh, absolutely. I'm sure there's so many emotions that they go through, and the grief of not having that, standard normal process that you have a picture in your mind of what your labour and your pregnancy and your birth and your, happy bouncing baby at the end of it. So, yeah, there'd be some grief and sadness, but also, I guess a lot of women and families would be happy that their baby was born okay and that we have the technology to help, even if they are born early. So
how did you help families with that firsthand in terms of what would you say to them, or how would you care for them to make them feel better about it?
Look, you just try and support them as best they could. I think things have also, since I worked in the neonatal unit, things have come a long way in terms of putting the parents first and really designing, even like redesigning the spaces to help with the parents, like making it more parent-friendly. So there's places, private places to breastfeed and things like that. So I think, things have changed and they are for the better. But, all you can do you're there caring for their baby, just trying to bring them into that, get them involved in that so they still feel it's their baby that,
Because they have to spend a lot of time apart.
Yeah, exactly. So, you try and involve them in the care and help with that bonding, and just, do whatever you can within your power to make their journey, not that it's easy, but as easy as you can.
What did you struggle with that part of your career?
There's obviously times when it was sad, when things didn't go so well, and not all babies actually survive. So, and that's always really challenging. If you have got to know the family and you're looking after that baby, or even if just it happens in the unit and you're not looking after the baby, you still feel it. You still feel the sadness and, that happens. So, that's always hard when you're working in health. And
how would you put that into perspective and come to grips with that when that happened?
Yeah, it's hard. I guess it's something as a nurse or a midwife or anyone in health, you sort of just learn to deal with it. I think it hit home more for me once I had my own children. It's sort of, I don't know, it almost made you feel it a bit more because you could have more of an empathy. Not saying that you can't be, sympathetic or empathetic if you haven't had children, but for me, it was even a bit more challenging because you sort of you imagine it if it happened to you. And
you can attach the thought to the feeling.
Yeah. So, but there's also a lot of joyous moments as well. So I guess that's, you try and rationalise that in your mind, that sort of balances out the sad times. So.
What was it like for you having your own children after having a career already of delivering other people's children?
Yeah, it was interesting. It is interesting because, you can have all the intellectual knowledge, you can read all the textbooks. When you're actually living it, it's different. I don't think it really helped at all. I mean, maybe it did, I don't know. But when you've got my first cried all the time and I'm thinking, I'm a midwife. How can I not make this baby sleep? So yeah, it didn't really help with having a settled child. But
did it make you feel even more passionate about the work that you do?
I think it gave insight into, like I said, all the, intellectually, everything that happens, but then actually feeling it and experiencing it, I think that added another depth to, of knowledge and understanding, I guess. Yeah.
Was it clear to you that there was a real need for more research in this area in general in regards to prematurity and the time before birth, everything? Did that sort of stand out to you when you were working?
When I was working, I didn't really have an understanding that there were things that could be done to perhaps reduce preterm birth. I'm not sure. Well, in regard to nutrition, I don't think we probably didn't even know that. It wasn't really known back then either. But so, I mean, there's always, when you're working in a clinical environment or in health, I think there was always the knowledge that to look at why do we do things the way we do and like question and
could it be better?
Is there a way that we could do this better to have a better result, better outcome? So there was always that I always had those sort of questions in my mind, even when I was working as a midwife. And if there was ever any research in the unit, I was quite ready to help out with the research. But I think that will always need to be looking around and asking questions. Is there a way we could do this better? Because until you've actually
always
done.
Will be.
Yeah, I know. Exactly. That's just, that's how I roll. Yeah.
What made you turn your hand to research?
It was a little bit by accident. I mean, I was interested in, and then a role just came up that was a part-time role just to help out with some research in another department within the hospital. It was a pediatric influenza study. So I was sort of seconded from where I was to help out on that for 6 months. And I just, even though it wasn't in my field, I mean, it was still helping children, but I just loved the research process. I loved the fact that, there's a protocol that you have to follow. There's rules. There's a beginning and a middle and an end. And yeah, it just really suited me, and that you get an answer to a question at the end of it. So that sort of piqued my interest in research. And I started working with Professor McCready's once I came back from maternity leave on a infant feeding study, and going and visiting families' homes and, weighing and measuring babies and in a research trial there. And just I never looked back from there, actually. My career just progressed from there, and I got more and more involved with the research, and then went on to do my PhD, and so now I design my own research. So
was it hard to give up midwifery?
I did miss that one-to-one contact that you have with people, and getting, that's you sort of get a warm fuzzy feeling when you're looking after someone and you have that connection.
And that high of delivering a baby.
And
as well.
the high of delivering a baby. But I don't know, it was great at the time, but I love the research, and I love now that the fact I get to do research, but I'm still in that space. So I'm still working in research with pregnant women and helping them and helping children. So I still sort of feel I'm connected to the whole pregnancy, childbirth, children side of things, but just in a different way. So it's the best of both worlds for me, because, I do love the research side of it. So
totally. Does it feel like you can actually contribute more as a researcher than as a midwife? Or differently, I suppose?
I think differently, maybe not so much more, but definitely in a different way. So, instead of helping a different family or families each day, what we do now is actually spread around the world. So people look at the papers that we write here from SAHMRI Women and Kids and use them when they make new guidelines for ways to treat different childhood conditions or pregnancy throughout the world. So the impact that we have is far reaching, which is, so it's different than affecting, the number of families you could affect on a day-to-day basis.
And it must be cool to sit back and think, oh, I did that, or I was part of that.
Yeah.
And that's a real thing. And the world actually hadn't seen that before.
Exactly. And I think I've been very lucky because, a lot of people work in research for years and years and years, and sometimes you don't always get the result you were expecting, or
it takes a long time.
Or it takes a long time. But I've been lucky enough from the trials that I worked on, back when I started my research career, and now there's so much evidence now that they've actually been translated and changed clinical practice. So from the work that we've done on omega-3 over the last 15, 16 years, we now have added a test that women can have for free to find out what their level of omega-3 is in their blood. And then a simple act of taking omega-3 supplements, if they're low in omega-3, can actually help reduce their risk of preterm birth. So I've seen it come full circle into actually changing practice. And a lot of, that doesn't always happen. Sometimes it takes a lot.
Well, a lot has to go right to get to that point.
Exactly. Yeah. So that's pretty amazing to see that actually happen. So yeah, and be part of that.
And seeing your research translate into clinical practice, that's really the goal for researchers, isn't it?
Well, that's why you do it. That's, the whole aim of it is to find ways to improve life by, and, insert it into everyday clinical practice so it can help, so many people.
So what have you and your colleagues found out about the link between omega-3 and preterm birth?
Yeah, so we firstly did a trial to see if omega-3 would reduce postnatal depression and help with infant development. And that was back in, I think, 2005, the Domino trial. We didn't see any really strong results in that area, but what we did see from that trial, because you always have some, they're called secondary outcomes that you look at. You look at what else that omega-3 in pregnancy could have affected, and we saw a big reduction in preterm birth. So that's when we went on to do the ORIP trial. And in the ORIP trial, it was a big national trial, over 5,500 women. Half of them had omega-3 supplements and the other half had supplements that didn't have omega-3. And overall, we didn't see any big differences. But when we looked deeper into the results of the ORIP trial, we saw that women who are low in omega-3 in early pregnancy, and then if they were supplemented with omega-3, like took omega-3 supplements, then it actually reduced their risk of early preterm birth quite significantly. There's been a lot of other research over the last 10 years as well. There's a Cochrane review that had over 70 trials in it. That also suggested that omega-3 reduced preterm birth. So that, together with the results of our ORIP trial analysis, that was enough then to say, hey, look, we've got an answer to this.
But it wasn't as simple as, okay, everyone should just take omega-3 supplements.
No,
because
that's right.
If you have levels of omega-3 that are too high, then that's also bad.
Exactly. So it's the same with a lot of nutrition studies, that if you don't have enough, it's not ideal, but having too much also isn't ideal. So it sort of cemented that thinking that it depends on what's already in your blood as to whether you need additional omega-3 as well. So it's not just a matter of, right, everyone go out and take fish oil supplements.
That'd be good, but
yeah,
too easy.
It'll be easy,
Yeah.
but that's not the answer. And I guess that's what the ORIP trial proved, and that's why we didn't see anything, because, some people were low, some people were high, everyone was taking them. It wasn't clear what was actually happening. So, and I guess that's the benefit of research and looking deeper into all of that big trial that we did. And
so now with the screening program, which is the first in the world, what's that shown initially?
So together with SA Pathology, working with them, we've added in that free omega-3 test into it's called the SAMSAS, the South Australian Maternal Antenatal Screening Program.
Well done.
Yep. So that's, it's just added onto that form. And so there's no extra blood test. Women can just have the test. And we're finding similar results to ORIP in that around 17% of women are returning results that are low. And then those results go back to their GP, and then they're advised to take supplements. So we will be continuously evaluating that program, and at the end of it, we'll then look at the preterm birth rate to see if, implementing a blood test and advice to women to take supplements if they need them can actually have an effect in, a real world setting once it's out in the community.
And you're also on a mission to find out the ideal amount of iodine that pregnant women should consume in their diet for their baby's development as well. Tell us a bit about that.
Yeah, that's right. So women who are advised in pregnancy to take an iodine supplement. But again, it's that whole theory of, well, if you already have enough, do you actually need more? So we're doing a trial, national trial, where we're inviting women who are less than 13 weeks of pregnancy to take part. And what we're doing is half of the women will have a prenatal multivitamin supplement that has iodine in it, and the other half will have one that's had the iodine removed. But we'll only include women who we know are already getting enough iodine from their diet, because we think that if they're getting enough iodine from their diet, they don't actually need the additional iodine, and that too much can actually result in lower developmental scores in their children, just the same as, not quite having enough does as well. So again, it's a question that needs to be answered. There hasn't been a clinical trial of iodine supplements on top of having iodine in the diet, because in Australia and a number of other countries, our food is fortified with iodine. So it's important to know, are they doing the right thing? Are they getting the right amount?
And you're changing the mindset of, okay, so the rule of thumb is you should just take it. You should just blanket rule, you should just take omega-3, you should just take iodine.
Yeah.
And that's actually not true, but people wouldn't know that, and
No,
they
that's
certainly
right.
wouldn't know what their levels are of that,
Yeah.
and that's actually crucial.
Yeah.
It's pretty important.
Yeah, I guess it's a bit, sort of moving towards precision nutrition.
I like the sound of that.
Yeah, and it amazes me. Like, even as a midwife, I didn't know that nutrients could have such an effect. Who would have thought that a supplement could change your risk of having a preterm birth or not? I had no idea. So I'm not surprised that people aren't aware of that. But I don't know, it seems like some people do have the mentality that, if something's good for me, more must be better. So I'm not just going to take one, I'll take 3 of those. And it's like, no, that's not how it works.
Moderation is key. How does working at SAHMRI help all of this come together?
Well, we've got such a fantastic group at SAHMRI, women and kids, of researchers, and we work with clinicians. We're actually based within the Women's and Children's Hospital, which is really beneficial to us, being a part of the hospital as well, and, access to pregnant women and their children. We have great statisticians as well, and just all the infrastructure with SAHMRI. Trials, the way you do trials has changed a lot over the last 2 years, especially with with COVID pandemic. So we've changed the way we do business really, and have tried to go a bit more survey-based, electronic-based, use digital marketing to try and enroll people, so we don't have to see people face-to-face with all the social distancing requirements. And I guess SAHMRI has all that great IT team to help out, and the marketing and comms team that give us advice. So I guess you're just being a part of SAHMRI, you have access to all the experts that you need to bring everything together to be, because, the way we recruit for our trials now, we're sort of leading the way with that. We have been doing it for a while now, but we are one of the first, groups to start doing that. And that's, I think, because we had the support of all of those other areas within SAHMRI to help just get it up and going when we needed to.
Well, it's that real mecca of collaboration, which
Exactly.
ends up in things happening faster than they
Yeah,
otherwise
absolutely. Yeah. And you've got the top minds there to all come to the table. So, it makes life a bit easier for the researcher.
would. And why have you signed up to trek 30 Ks through the dark of night for the bright walk?
I keep asking myself that question. I do like to walk. I don't normally walk 30 Ks.
Especially not at night time.
Especially not during the night. But hey, it sounded like an adventure, and it's for such a great cause to raise awareness. I'm not sure if we could have done it with 3 kilometres. I think that would still have
Probably not
been
enough
okay.
of a challenge.
Maybe not, but
What's the importance of raising awareness and funding, though, for health and medical research?
I think it's so important. We need money to keep doing what we're doing. getting grants to keep the work going is so hard. It's so challenging, and the success rates are so low. You know what needs to be done, but you can't always do it because you actually don't. You might not win the grant with the 10% success rate.
And spend a lot of your time doing it as well.
Oh, so much time. Yeah, it does take up a lot of our time. But I guess as well as the funding, it's also the awareness for the public about the importance of clinical trials, because we need people to take part in our trials. So I guess just raising that awareness of the importance and, getting people educated about trials and what they're about, that needs to be done continuously so people are willing to take part.
Because it doesn't happen without the public.
It doesn't, no. They're so important because we collect reasons with our digital marketing for our clinical trials. We always ask, can you tell us why you signed up for this trial? And I love reading all through those. We've got thousands of responses. This is from pregnant women. And I was a bit surprised. I mean, because you can sort of guess why people might want to, but I was just shocked at how many people, it's pure altruism. It's because they want to help other women. They want to help children. They want to, advance the future of it. So many comments just says, I find like it's amazing.
And I hear you've been stepping up your training in preparation for it.
How do you know that?
You told me.
You've been spying on me. Yeah, I have. I have been trying to walk a bit more.
You're trying to come first?
I don't
it's
know.
It's not a race, Karen.
I just want to finish. Yeah, no. So normally I do around 4 kilometres a day, and I'm thinking,
that's pretty good.
Oh, is it?
4Ks a day, that'll add up.
Okay. Yeah. So I'm not sure if I'll do the whole 30 before the 30. I don't think I will, but I just wanted to time myself because I was trying to work how long it would take. So I'm thinking around 6 hours.
It's a pretty impressive commitment to the cause, I reckon.
Oh,
we're very proud of you. So when the time comes for you to step away from research, what do you want to be able to look back and say?
Look, I want to have made a difference, but I kind of think I've already done that now. But when I do step away, I hope there's more and more. Like I think my part of being part of all the omega-3 work, I think I have contributed to making a difference there. I hope I get to find answers to a few more questions before I finish, like the iodine and folic acid and other nutrients in pregnancy that we can advise women what the best thing to do is. So I just want to get through as many as I can so you can answer as many questions as I can before I stop.
Well, you've done so much tremendous work already, and you're a great example of what SAHMRI's about, but there's always going to be more questions to answer.
Yeah, absolutely.
That's the fun of it.
Yeah, it is. That's what we're here for.
If you want to learn more about SAHMRI and the researchers working to build a brighter, healthier future for you and your family, head to sahmri.org.au.